I'm Don Fry, President and CEO of the Greater Baltimore Committee, and welcome to GBC Insider, a program designed to hear from leaders in the private sector, elected officials, and members of the media to gain insights on key issues in business and government. Today, GBC Insider is joined by Dr. Letitia Dzirasa, Commissioner of Health for the City of Baltimore. Dr. Dzirasa, thank you for joining us.
Thank you so much, Don, for inviting me.
So while COVID-19 has certainly dominated the news for the last 2 years, Baltimore City and the entire state has another ongoing health emergency, the opioid overdose crisis. A report of the Maryland Opioid Operational Command Center found that in 2020, a total of 2,499 citizens died of opioid-related overdoses statewide. And of those, about 954, or 38%, occurred in Baltimore City, placing this number one in the state for opioid-related deaths. Can you provide us with some update on what programs or steps are being taken to help reverse that trend?
Sure. So first, I definitely want to commend the previous health commissioner, Dr. Lena Nguyen, who really did so much groundbreaking work to help address opioids. So again, much of what we're doing is building upon a lot of what was already in place. And so, one of the programs that she started, which I think was very unique, was this allowing naloxone to be kind of universally available and encouraging certainly regular citizens, but also encouraging businesses to have naloxone on site in the event that you come across someone who may be experiencing an overdose, and you don't have to be a trained medical professional to administer it. It really is something that could potentially be life-saving in this instance. So I think that's critical, and we continue to do that work. I think education is also still very, very fundamental when we think about substance use disorder, right? I think, we want to, as much as possible, avoid stigmatizing individuals with substance use disorder. We know that this is an illness. It's not, a moral failing. And so as much as we can provide education to employers that come across an individual with substance use disorder, and really encourage them not to necessarily stigmatize, but to be empathetic and how they're really approaching that individual, that I think helps, right? Every little bit helps. I will say, just to talk a little bit about the data, there was initially a decline in opioid deaths in the first part of 2020, perhaps during the time when we were again on relatively lockdown measures, but we did begin to see this sharp increase once things began to open up. So one of the things that we're really supportive of is telehealth for substance use disorder treatment. So again, thinking about just access to treatment services and how critical that is. We know that was challenging early on in the pandemic when everything was kind of shut down. Again, continuing that naloxone distribution and making sure that we can support, especially those with substance use disorder that are also experiencing homelessness with more stable housing.
So what role can the business community play in helping the city address the opioid overdose crisis, both from an illegal and prescription drug perspective?
Sure. So I'm going to again talk about education for your workforce. So we're happy to support, providing appropriate educational resources. So again, there can be conversation and destigmatization around substance use disorder. I would also encourage, employers who have not already to become a part of what we're calling our community of first responders. So I mentioned naloxone as a treatment to reverse overdoses. We can provide, or one of our partners can provide, education, training, and support on distribution of naloxone to businesses. And again, how do businesses then, effectively use naloxone once they've received it? So providing that additional training and support.
So Dr. Dzirasa, thank you for your insights on two very significant public health challenges in our city and state. Your dedication to fighting these ongoing crises during this time is commendable, and we thank you for your service.
Great. Thank you for having me.
The GBC will continue to provide our members with more informative interviews with key insiders in the business and political community. Until the next edition of GBC Insider, I'm Don Fry, urging you to be safe, stay healthy, get vaccinated, get boosted, and remain positive. Thank you for joining us.